Hello, I'm Dr. Christopher Hart.
And I'm Dr. William Johnson.
Welcome to AtlantaBariatrics and our online seminar.
We want to thank you for taking the time today to attend our online seminar and hope you enjoy learning more about weight loss surgery. Before we get started, we would like to ask that you are in a quiet environment. The seminar will be broken down into 4 sections, and each section will have quiz questions to make sure that you are retaining all the information. You're going to want to set aside about an hour to view the presentation and to complete the quiz questions. And please have a pen and paper ready. We want you to write down any questions that you have and bring them to your consult. We'll be happy to meet with you as many times as you need to make sure that all your questions are answered before surgery. To pass this seminar, you must achieve a score of 80%. You will have 3 attempts to pass this test, but if you do not pass, don't worry. Just contact our office and we will let you know the next steps. We'll now begin the seminar. During the presentation today, you're going to be learning about our practice, Atlanta Bariatrics, and why you should choose us for your weight loss surgery. We'll be talking about obesity and how it affects your health. We'll be talking about the various weight loss options that we offer at Atlanta Bariatrics and which option is best for you. We'll be talking about how all the surgeries work and what you can expect both before surgery and after surgery. We're going to talk about how you can afford the surgery, whether you have insurance or not. We're mainly going to be talking about commitments and the things that you need to do to help be successful. And then we're going to be talking about where do we go to get to the next step.
I'm Dr. Christopher Hart, and I'm one of the surgeons here at Atlanta Bariatrics. I did my surgical training at the Mayo Clinic before moving back to Atlanta. I was one of the staff surgeons at Emory University School of Medicine and was one of the co-founders of the bariatric program there before founding Atlanta Bariatrics. I currently serve as the Chief of Staff of the Emory Johns Creek Hospital and also serve as the Medical Director of the bariatric program there.
I'm Dr. Will Johnson. I'm one of the surgeons here at Atlanta Bariatrics. I'm a bariatric surgeon and this is what I do for a living. I did my training at the University of Florida and then did a fellowship at Duke University just doing bariatric surgery. I joined Atlanta Bariatrics in 2006 and have done well over 1,000 cases. I am a Center of Excellence surgeon and accredited by the American Society of Metabolic and Bariatric Surgery. I'm on staff at several hospitals to perform bariatric surgery. Our staff is dedicated to bariatrics. We have bariatric coordinators that are going to help you with the insurance process and make this whole process as easy as we can get it. We have dietitians on our staff. We're going to try to make this whole process easy for you and help you along the way. Our program, Atlanta Bariatrics, is a designated Center of Excellence program. Dr. Hart and myself are both designated Center of Excellence surgeons, and we operate at Center of Excellence facilities. We have a multidisciplinary approach to bariatric surgery. We include dietitians, psychologists. We provide a lot of education both before and after surgery. We have support group meetings. We think all of this is important to be successful with weight loss surgery. We'll also employ other specialties as needed, including pulmonology or cardiology as necessary. Why should you choose Atlanta Bariatrics? I think the number one thing you want to look into is experience. This is what we do for a living. There's no doubt that when you go to practices that this is what they do, you're going to get better outcomes. We put you through a big evaluation and treatment program before the surgery, all to get you in the best medical shape that we can prior to surgery. We're very proud of our track record here and strongly encourage you to go to support group meetings. You'll not only find out about our practice this way, but you'll also be able to talk to people that have been through the surgery and get questions answered. We're very dedicated to our bariatric patients. People all the time ask me, why do you do this? I think there's nothing more rewarding than to watch somebody and just see the differences right before your eyes as they transform into a healthier individual. Both Dr. Hart and I are Center of Excellence surgeons accredited by the American Society of Bariatric Surgery. Our practice is a Center of Excellence practice, and we operate at Center of Excellence hospitals.
You've probably heard in the news about the obesity epidemic that's sweeping the country. 3 in 5 Americans now are either overweight or obese. In the past 20 years, adult obesity has doubled. To put this in perspective, there are over 300,000 premature deaths every year due to obesity. Compare that to about 900,000 deaths combined each year from colon and breast cancer, or 400,000 deaths per year from smoking, which is actually decreasing. A real concern is our children. Over 75% of obese children will become morbidly obese adults. If you look at this map from the Centers for Disease Control, you'll see that in 1985, only a small percentage of our country was actually obese. But as we progress over the years, up until today, you'll see that obesity has swept across the country. And it's projected that within the next few years, over 40% of our population will be obese in every state in the Union. Why lose weight? Well, we know that your risk of dying early is doubled compared to someone who's not obese. Your risk of dying from diabetes or heart attack is 5 to 7 times greater. But more importantly, there are multiple weight-related comorbidities.
Obesity is a known risk factor for many medical conditions. You can see by what we call here the short list of conditions that many of the most deadly diseases there are affected directly by obesity. Diabetes, heart disease, strokes, sleep apnea, the risk of all those go up just from being obese. One thing that's not talked about a lot is the risk of cancer. And these aren't cancers that are rare, these are the most common cancers that people get. When you're obese, you're more likely to get breast cancer, you're more likely to get prostate cancer, you're more likely to get colon cancer. And it is so prevalent that there is a 52% higher death rate from cancer for men and a 62% higher death rate from cancer for women. It affects both sexes fairly equally. You can see by this graph that as your BMI goes up, your percentage chance of developing these health issues goes up exponentially. To determine if you're a candidate for surgery, we use a mathematical formula called the BMI, the Body Mass Index. When your BMI is between 18 and 25, it's considered normal. Anytime your BMI is over 25, you're considered overweight. When your BMI is over 30, you're considered obese. Once your BMI hits 35, you're considered severely obese, and any BMI over 40 is morbidly obese. Your BMI is determined by inserting your height and your weight into the mathematical formula. We provided a chart here so that you can figure out your BMI if you do not know what it is.
So is weight loss surgery the best option for you? The bottom line is that we'll talk one-on-one when we see you in the office for a consultation. But as a general rule of thumb, we like to see that you've tried other things for weight loss before. For patients who have a body mass index over 40, you will usually be a candidate for the surgery. But you could qualify for the surgery with a body mass index between 30 or 40 if you've developed weight-related health problems. We want to make sure that you understand the risks and the benefits of the surgery and be ready to make a lifelong commitment to change your habits and lifestyle. As you know, there are various options for weight loss, and you may have tried many of these. Diets and exercise play their role, but you may have already found that multiple diets have been frustrating. There are also prescription medications. However, on average, with a prescription medication, a bariatric patient could lose 15 pounds. That's great if you're only 15 pounds overweight, but if you have a lot more weight to lose, we need to look at other options, which leads us to weight loss surgery.
How does weight loss surgery work? All three of the main procedures that we offer at Atlanta Bariatrics work by restriction. What I mean by that is that it will limit the amount of food that you can eat. You will feel full eating a very small amount of food, and it will limit your hunger. All three surgeries, the lap band, the RYGB or the gastric bypass, and the sleeve gastrectomy work by this mechanism. The gastric bypass does also have some malabsorption, and it also works by behavioral modification. This is often referred to as dumping syndrome. When you eat a food high in sugar, you can often feel nauseated, have abdominal pain, have diarrhea, feel flushed, you feel horrible. And you know what you never want to do again? Eat that sugary food again. It changes the way you psychologically think about that food. And that really helps you stay away from those foods that often get us into trouble. At Atlanta Bariatrics, almost 100% of our surgeries are done laparoscopically. What I mean by this, instead of the old-fashioned way of making one large incision to do the surgery, we do it with several little tiny incisions. This has a ton of advantages, and they're all for the patient. With the laparoscopic surgery, you have a lot less scarring, a lot less pain, you get out of the hospital much quicker, your recovery is much quicker, and you get back to all your normal activities much faster than the old way. The complication rate has gone down tremendously when doing it laparoscopically. Now, there are certain cases where it could be difficult to be done laparoscopically. The first instance would be if you've had too much previous abdominal surgery that has caused such extensive scar tissue that it's difficult to maneuver in the abdomen. Now, most of our women have had some kind of gynecological surgery, a C-section, a hysterectomy, and that doesn't tend to be an issue. Having your gallbladder out or appendix out doesn't tend to be an issue. It would be surgery such as an extensive colon or stomach operation. But even in those situations, we're still able to get around the scar tissue and perform those surgeries laparoscopically. The other time when laparoscopic surgery could be difficult is if your liver is just too big. One fascinating thing about us is that when we gain weight, one of the first places you add that fat on is in your liver. And when you lose weight, one of the first places it burns it is in your liver. Your liver sits right on top of your stomach, right where we're operating. And so the last thing we want people doing right before surgery is gaining a bunch of weight. That would obviously make the surgery a lot harder, and that's not in your favor. You want a much easier surgery. And so try to lose a little weight before surgery. At a minimum, we want you to be around the same weight as the weight when we first meet you on your initial consult. We're now going to talk about the lap band procedure. The lap band procedure involves placing a silicone band around the upper portion of your stomach. There is no dividing of your intestines. There is no rerouting. All of your GI intestines are just like they are right now. You absorb all your vitamins and minerals and nutrients exactly like you do right now. This band has a balloon on the inside, and the band is connected to some tubing that goes to a port. This small port is about the size of a quarter and sits on your six-pack muscles. It's below all the skin and fat. There's nothing hanging out. No one's going to ever know that you have a band in place. In order for the band to be successful, you do have to come in for follow-up. It is vital that that follow-up is attended because the band will not work without it. What we do in clinic is actually access the band. We have an ultrasound machine that we use to make this as easy as possible. We stick a small needle directly into the port and inject fluid into the band. This causes the band to be tighter and will cause the food above the band to hold up. The whole goal is that food holds up enough that you feel full. What's amazing about this procedure is that all the stomach below the band, if that stomach is empty, but that stomach above the band is full, you feel full. If the band is not tight enough, the food will go through the band, go down very easily, you will not lose weight. When that band is properly adjusted, you should be losing at least 1 to 2 pounds every week. You should feel very full, eating a very small amount of food, and you should not be hungry between meals. If you're not meeting all 3 of those criteria, then you need a fill. We generally start doing fills when you're 6 weeks out from surgery and do them every month thereafter. I always tell patients, I want you to be happy and me to be happy with your band level. You should never feel uncomfortable. If you're feeling reflux or you feel the food is too tight, you simply remove the fluid. That's one of the beauties of this operation, is that it is adjustable.
The lap band provides slow, gradual weight loss. It also provides a prolonged sense of fullness after small meals. When adjusted appropriately, it's a long-term tool to help you keep the weight off.
What are the risks of lap band surgery? Lap band surgery is considered the safest of all the operations and generally considered no more riskier than getting your gallbladder taken out. But there are risks. The lap band is a foreign body. If that foreign body was to become infected, it could require removal. Band slippage occurs when the stomach goes underneath the band and causes the band to move. This could require a surgery to fix. Other known complications include erosion, deflation, and port issues. If the band was too tight, it could cause an obstruction of the stomach or esophagus and could require fluid to be removed. The band requires the most amount of follow-up in order to be successful. And always remember, all the calories that you eat count.
Now let's focus on the sleeve gastrectomy. This is the latest procedure we offer here at Atlanta Bariatrics. It was originally started as part of a 2-stage procedure leading to a gastric bypass. However, we found through data across the country that as a standalone procedure, the sleeve gastrectomy is very effective at weight loss. It's a restrictive procedure, meaning that it's very effective at limiting how much food you can take in at one time. It's also very effective at providing a sense of satiety with only a small amount of food intake. Unlike the gastric band, there's no foreign body to implant. And unlike the gastric bypass, there's no rerouting and reconnecting of the intestines. There are no adjustments, but one unique thing about the sleeve gastrectomy is that it's the only operation where we actually take out a part of your stomach. By doing so, we limit the production of a hormone made in your stomach called ghrelin. Ghrelin is responsible, in part, for you feeling hungry. Therefore, when we take out a large portion of your stomach, we decrease the amount of hormone that makes you hungry. It's just another way that this procedure helps you to lose weight without feeling hungry. The benefits of the sleeve gastrectomy include the fact that there's no foreign body, as there is in a gastric band. The rate of weight loss is very similar to a gastric bypass, with a faster improvement of comorbidities relative to an adjustable gastric band. And it's the one operation where a portion of the stomach is removed, thus decreasing the hunger-related hormone called ghrelin. The risks of the sleeve gastrectomy are essentially in the short term. As with any operation where we cut part of the intestine or stomach, there's a risk, although very small, of staple line leak. The risk of malnutrition is very low because we haven't rerouted any of the intestine. There's no very long-term data, although we do have very good 5- and 7-year data for the sleeve gastrectomy. And remember, because this is a restrictive operation, the calories that you do intake still count.
The next procedure we're going to talk about is the gastric bypass. This is considered the gold standard operation and historically has been done more than any other weight loss surgery. It has been around since the 1960s, so we have studied it extensively and have followed patients for over 20 years. What we do with this operation is that we make a small pouch out of the upper portion of the stomach. Your stomach is usually about the size of a football, and we now make it into about the size of an egg. We then divide your intestines down below and connect it to that pouch. All the food that you eat will now go down your esophagus, your swallowing tube, into the pouch, and then directly into the intestines. We also make one other connection down below to rehook the intestines back together. The old stomach is not removed. It still makes digestive juices that mix with bile and pancreatic juice to go on and absorb your food downstream. We did not bypass very much intestine at all, and the majority of your intestine is left intact. This allows for the absorption of most all vitamins and nutrients, as well as all medicines, antibiotics, etc. There are a few vitamins and minerals that are affected with the gastric bypass, and so it becomes very important that if you get this surgery that you get on supplementation. These surgeries require you to be on multivitamins, B12, as well as calcium. We will be testing for other things annually to make sure that your iron, vitamin D, and other levels are appropriate. This is a combination procedure. There is some malabsorption as well as dumping syndrome involved. The gastric bypass has a tremendous amount of advantages. Since we've been doing the surgery since the 1960s, we know the most about it, and we know what vitamins need to be followed and what kind of complications could arise. It gets the weight off very rapidly. In general, you're going to lose approximately 70% of your excess weight during that first year. Most of that weight comes off the first 6 months. This allows for very rapid resolution of your health issues. You're able to come off your diabetic medicines or get rid of your CPAP machine much earlier with this operation than you are with some of the other ones. This operation works particularly well for patients that are diabetics. There is no better operation for curing diabetes than the gastric bypass surgery. The other health issue that it works really well in is reflux. People that have gastroesophageal reflux, this is almost a 100% cure for that procedure. This was a study done on over 22,000 gastric bypass patients. And I think it's one of the most important slides we show because it shows how much just losing weight improves your health. Patients who underwent the gastric bypass, on average, resolved or improved their diabetes 86% of the time and had complete resolution almost 77% of the time. High cholesterol improved 60%, high blood pressure improved over 60%, sleep apnea 85%. This is a very short list of some of the benefits you get from the surgery. Just losing the weight improves your health so dramatically. I always tell people if I had a medicine I could give to every diabetic and it would cure their diabetes 80% of the time, I'd have the Nobel Prize for medicine and I'd be a billionaire. I have a surgery that offers this and so much more. Just losing weight, look how much better your health gets and look how much better your life can get. There are some known risks with the gastric bypass. Because you're dividing the intestines and making connections, you could develop a leak, which is not enough scar tissue forming at that site. We will test for that in the operating room and make sure you do not have a leak when you leave. You could also develop too much scar tissue, which would be a stricture. Other risks associated with the gastric bypass would be twisting of the intestines. This is a rare complication, but is known with the surgery.
As with any surgery, bariatric surgery does have its risks, and obesity increases the risk of any surgery. These risks include the risk of anesthesia, bleeding, infection, blood clots, heart and lung problems, or even death.
The mortality rates for weight loss surgery used to be much higher. As we've created these centers of excellence and we have improved our outcomes, they have dropped tremendously. Most centers of excellences have a statistic of around 0.5%. Ours is much lower and is less than 0.1%. As you can see with this graph, there are differences with the surgeries as far as how fast you lose the weight. With the gastric bypass and the sleeve gastrectomy, you in general are going to lose most all the weight within that first year. With the lap band, the weight loss is slower, although you can also see by this graph, you eventually catch the gastric bypass and the sleeve gastrectomy. We have some patients that do much better than the average. They lose 80, 90, even 100% of their excess weight loss. We also have patients that don't make the average. This is where your part of the commitment comes in. This is where how well you do with diet and how well you do with exercise factors in. If you want to do better than the average, then I tell patients, you need to work harder than the average patient. If you want to do upwards of that 80, 90%, you want to get most of your weight off, you're just going to have to work harder. The beauty of these surgeries is that it makes it easier to do so. It makes the diet easy. It makes it so you feel very full eating that small amount of food. You feel very full eating very limited amount of calories. Now what calories you eat are up to you.
Let's look at what you can expect after the surgery. With any of these operations, we can perform this laparoscopically, which means very small incisions and a quicker recovery. In fact, with a gastric bypass, we can even perform this robotically. As far as a hospital stay, most of our gastric banding patients go home the same day. Nowadays, most of our sleeve gastrectomy patients go home the same day, although they may want to stay overnight as an outpatient. Our gastric bypass typically stay 1 or 2 nights in the hospital. We have you walking around the same day as surgery. We also gradually advance your diet. You can expect to be on a liquid diet for the first 7 to 10 days, then advance through a puree diet to a soft diet over the next week to 2. You'll get a lot more information about what you can and can't eat from our registered dietitian when you see us in the office.
I'd like to make a special note to women of childbearing age. It does become particularly important to avoid getting pregnant that first year after surgery. It is especially important for patients who undergo a sleeve gastrectomy or gastric bypass procedure. We have started a process of rapid weight loss. And by doing so, if you became pregnant, you would put the baby at risk for miscarriages or fetal defects. We have to stop the weight loss process and make sure that that baby is getting enough nutrition. And after you deliver, you never get back on that weight loss program again. Whereas if you wait and lose all your weight and level out, then become pregnant, you can just gain the pregnancy weight and come right back down to where you were before.
Let's look at nutrition and exercise after surgery. When you're drinking after surgery, we like you to focus on a small amount, about a shot glass size, every 10 or 15 minutes. When you're eating solid food, it's very important to chew your food very thoroughly. When you're drinking, you can continue to drink every 10 or 15 minutes a few sips. But when you eat a solid meal, we like to have you refrain from eating and drinking at the same time. So when you eat your meal, wait 45 minutes or an hour before you have something to drink. Vitamin and mineral supplementation are important, especially after a gastric bypass, because of the small degree of malabsorption we've induced. It's really quite simple. We have you chew up 2 multivitamins in the morning, 2 calcium tablets in the evening, and once or twice a week a vitamin B12 under your tongue. We'll monitor your laboratory values, including your blood counts, your iron levels, your vitamin levels, and other mineral levels, to make sure that you're getting the appropriate nutrition, and we can adjust those as necessary in your follow-up period. Most importantly, we want you to exercise. We understand that exercising at your current weight might be very difficult. We understand that. Therefore, it's important to start with a very modest goal of getting up, getting around, and moving in the early postoperative period. But we want you to continue to progress so that in the long run, the goal should be exercising in order to get your heart rate up and get sweaty 30 minutes a day, 5 days a week. It's really important to help you achieve your weight loss goals. Here at Atlanta Bariatrics, our office is very experienced at helping you through the insurance approval process. The first step will be to confirm if bariatric surgery is covered under your specific plan. Our office will help you with all these details.
For patients that don't have insurance coverage, there are cash pay options. The procedure cost will be determined at the initial visit, and the first 6 months of follow-up appointments are covered with the procedure. There are financing options available to help pay for the surgery. To find out more, please talk to one of our bariatric coordinators and they will give you more details. You can also apply for loans online.
For most of our patients, the cost of being obese is quite large. In fact, over $18,000 per year for most bariatric patients. Compare this to the cost of the surgery, and very often the surgery will pay for itself after just 1 year.
Where do we go from here? Once you've completed the seminar, you can fill out the patient information sheet and our office will be in contact with you to schedule your initial consult. You can go to our website, www.AtlantaBariatrics.com, to find out much more about what we talked about today. We also strongly encourage you to come to our support group meetings. They're very well attended, and you can not just hear from us what we do, but to hear from actual patients that have been through it. It is a much more rewarding experience to actually hear those people that have been through it, and they'll be happy to answer any question that you have about your surgery. We've talked today a lot about commitments. The next step is preparing yourself. We want to make sure all your questions are answered, and we'll be happy to meet with you as much as you need to get those questions answered. You've got to quit smoking if you're a smoker. It doesn't make any sense for us to cure the #1 leading cause of death and leave you with #2. Come to our support group meetings. We require everyone to come to at least one support group meeting because we want you to know what's out there and how rewarding and informative they can be. Start making your lifelong commitments. Start making your diet changes and exercise changes. Get rid of the old life and let's get on to the new life. You have to be ready to make the commitments to lifelong exercise, diet, and supplementation in order to be successful. We're going to give you the blueprint on how to do all this and have safety nets set up for you, but you have to do your part.
Here we have some before and after pictures of some of our patients. But remember, it's really not about the size of your clothes. It's about getting you healthy.
We want to thank you for completing the online seminar today and learning more about weight loss surgery. Our office will be contacting you, and we look forward to meeting you and getting you on to your goal of better health.
If you'd like more information now, please visit the rest of our website at AtlantaBariatrics.com, or feel free to call our office at the number here.